I'd like to welcome everyone to today's webinar, Creating a Culture of Compassion Using Appreciative Inquiry. I'm Stephanie Adler-Yuan, Director of Education and Training at the Schwartz Center for Compassionate Healthcare, and your moderator for today's session. The Schwartz Center for Compassionate Healthcare is a national leader in the movement to make compassion a vital element in every patient-caregiver interaction. Before we begin the formal presentation, let's go over a few details about the webinar. The Schwartz Center Compassion in Action webinar series is funded in part by a donation in memory of Julian and Eunice Cohen. Today's program will be 60 minutes long. The first 45 minutes will be a presentation, followed by a 10-minute question and answer session. Today's program is being recorded and will be available on the Schwartz Center website a week after the session. Please note that attendees are participating in listen-only mode, but can interact with the speakers by using the questions pane, which should appear on your screen. If you have any questions, please just type them into the questions pane and send them to us, and we will address as many of them as we can at the end of the presentation. We will be polling the audience during today's session, and we hope that you will participate in this interactive measurement tool. Finally, as you exit the webinar, you'll receive an electronic survey that we ask you to take a minute to complete so we may capture your assessment of today's program. Your feedback is important to us. And now, it is my pleasure to introduce my colleague and our host for today's session. Dr. Beth Lown is an Associate Professor of Medicine at Harvard Medical School and the Medical Director of the Schwartz Center for Compassionate Healthcare. Welcome, Beth.
Thank you, Stephanie, and good afternoon. Thank you all for joining us for our 2017 webinar series on compassionate collaborative care, what we're calling the Triple C. This compassionate collaborative care framework describes some of the key values and behaviors that help us offer this kind of care to patients, families, colleagues, coworkers, while also sustaining ourselves and our sense of meaning in work. And the framework's available on our website. This year's Schwartz Center webinar series focuses on creating organizational cultures of compassion and collaboration. And this is also the focus of our inaugural annual Compassion in Action Healthcare Conference held in Boston this past June. So now let me introduce today's session, Creating a Culture of Compassion Using Appreciative Inquiry. In this webinar, we will review the history of appreciative inquiry and focus especially on the use of appreciative storytelling as an organizational culture change strategy. And we'll also illustrate some simple techniques for bringing appreciative inquiry to participants' organizations with optimal chances for success. At the end of the webinar, participants will be able to describe the difference between production and relationship-based organizational culture, understand the role and power of storytelling in organizational work life, and immediately implement one or more appreciative practices in their workplace. And now I'm honored to introduce today's speakers. Dr. Richard Frankel is a professor of medicine and geriatrics at Indiana University School of Medicine and a staff member in the Education Institute of Cleveland Clinic. He's a medical educator, health services researcher who has spent the past 35 years focusing on strategies to improve communication and relationships between individual doctors and patients, and more recently in teams and organizations, and has been my friend for many decades. He has consulted to a number of large medical organizations on ways to transform their culture based on their positive accomplishments. He's a member of the Cleveland Clinic Professionalism Council, and the Indiana University School of Medicine leads the Aspire Advanced Scholars Program for Internists in Research and Education. Welcome, Dr. Frankel.
Thank you, Dr. Lown, and it's a sincere pleasure to be here this afternoon.
Thanks, Rich. Also with us today is Dr. Harry Bud Isaacson, who is the Assistant Dean for Clinical Education and Associate Professor of Medicine at the Cleveland Clinic Lerner College of Medicine. Currently oversees all clinical training for that College of Medicine and co-directs the Foundations of Clinical Medicine course. In addition, he serves as chair of the Professionalism Council and a member of the Board of Governors at Cleveland Clinic. He helped develop and lead a new Cleveland Clinic onboarding program in 2011, which includes the To Act as a Unit series on professionalism. Dr. Isaacson is currently leading an effort to enhance the annual professional review at Cleveland Clinic using Appreciative Inquiry. He has led the American Board of Internal Medicine Foundation's Roundtable on Professionalism for 5 years and is a fellow of the American College of Physicians. Welcome, Dr. Isaacson.
Thank you, Dr. Lown. Happy to be here.
Well, so with those introductions, I will turn the program over to our speakers.
Thank you, Dr. Lown. So here we are talking about a culture of compassion using appreciative inquiry. And I'll start by saying that appreciation is an important activity. We, in this hurry-up digital culture, often forget to value the things that are most important to us. And that includes recognizing the best in people, the best in the world around us, and affirming the strengths and successes in people and programs. So appreciative inquiry has been with us now for several decades. It was developed by David Cooperrider, who's a professor in the business school at Case Western University in Cleveland. And it came about from David's work in quality and safety, looking particularly at how automobile workers assured quality in the products that they made. And you know, we can think about the logic of production, which has dominated the way we think about quality for many, many decades. If I'm buying a car, I'm not involved in the production of that car, but I certainly want to have a high quality product that I can use. When we think about service encounters, and seeing a physician, medical care can be thought of as a service encounter, we co-produce the product. We use language and share back and forth, taking turns to talk as a way of co-producing the service. So that's an important distinction, co-producing a service versus being a consumer of a product. So appreciative inquiry is an organizational method to bring out the best, to search for the best in organizations, and to ask, how can we get more of what we do well rather than how to fix what's broken? And so we look for ways to discover the factors that give life to an organization, change from deficit thinking and deficit conversations to conversations about abundance, and to think together about our future vision, really set the stage for future action. So appreciative inquiry is about seeing things differently. As you look at this slide, you might see a frog. But if we were to look at it just a little bit differently, we might see something different. We might see a horse. So appreciative inquiry is about seeing things differently. It's about shifting our focus, shifting our frame just slightly to see the same thing in a different way or in different terms. So I think a good way of describing appreciative inquiry comes from Cherokee story. There's a story of a Cherokee elder sitting with his grandchildren. He says to them, in every life, there's a terrible fight, a fight between two wolves. One is evil. He is fear, anger, envy, greed, arrogance, self-pity, resentment, and deceit. The other is good, joy, humility, confidence, generosity, truth, gentleness, and compassion. One of the children asks, "Grandfather, which wolf will win?" The elder replies, "The one you feed." An appreciative inquiry is about looking for the best in people and the world around them. As we think about Western medicine, I think the dominant philosophy is the Cartesian idea of cogito ergo sum. I think, therefore I am. And we've spent many, many decades training physicians to be rugged individual decision makers, people who can think for themselves, people who are self-sufficient. And while this has worked very well, times have changed, and we have entered a new era, as I mentioned a moment ago, of co-production, that we co-produce medical care not only with patients, but with teams as well, sometimes called microsystems. Another way of thinking about the philosophy of medical education comes from thinking about the community. These are slides that I made in Paris. I call them my bench research, and you should all be laughing now, and if you're not, well, I can't see you, so. But the point is that there's a term used in Northern Africa called Ubuntu. And this philosophy says, I am because we are. I don't exist outside of the community in which I participate. And so this is a very different logic. It's a very different way of thinking about things and thinking about the connections between things. And this is where appreciative inquiry really has high impact. So here are some assumptions of appreciative inquiry. I'm not going to go through them all. I assume that you're all good readers. But I think the main thing is that appreciative inquiry thinks about organizations not simply as bricks and mortar, but as the sum total of conversations that are going on at any given moment. So an organization is more than just the shell around the organization or the architecture around the organization. It's what's happening. It's the life-giving conversations that are going on at any given moment. And the way in which we describe our organizations really creates the reality of those organizations. So the quarter turn that appreciative inquiry takes is to say that in every group, in every organization, something is going well, something is going right. And if we can turn our attention to what's going right and ask, how can we get more of it? We really find ourselves in a different space from deficit thinking, what's wrong and how can we fix it? So, you know, we do root cause analysis, and you could think of appreciative inquiry as just the opposite, root success analysis. What is it that we do when we're at our best? How do we achieve those great results? So some of the impact of appreciative inquiry is that it really strengthens the bonds between people, and it really creates a can-do culture. It also creates a kind of transparency and psychological safety in which people can come forward and describe errors that they've made without fear of retribution. In fact, what David Cooperrider found was that Japanese automobile workers, when they talked about mistakes, saw a mistake as a gift to the community, not as something to be ashamed of. And we still, in our culture, tend to think about errors and mistakes as involving shame and blame. So appreciative inquiry really focuses on the positive and how we can move ahead. So Dr. Isaacson and I are going to talk about two case studies. I'm going to talk first about Indiana University School of Medicine, and then Dr. Isaacson's going to talk about the Cleveland Clinic and how we've used appreciative inquiry in these two organizations. So this is an aerial view of the medical center, the Indiana University School of Medicine. It currently is the largest medical school in North America. It has an entering class of 366 students. It has a number of campuses, 9 campuses. Indianapolis is the largest with 165 students. The other 8 campuses are all smaller with 18 to 24 students. So it's a very large, very complex bureaucracy. I arrived along with my good friend Tom Inouye in 2002, and we brought with us an idea for a culture change project to change the culture of the medical school. And what we found was that Indiana University School of Medicine had some wonderful things going on, but it also had some real challenges. Some of those challenges were that budget and space were at a premium. Wouldn't be surprised if that was true at your organizations as well. A very bureaucratic culture trying to manage 9 campuses and have statistically similar results on exams, on national exams, is no easy task. There was a real feeling of anomie, of being separate, being alone, being isolated, the cogito ergo sum. And then there were definite rifts between the faculty and the administration. Well, the students did well on standard exams. They got good residencies. They were very unhappy with their relationship to the administration, felt that the administration didn't care very much about them. And we had seen for the preceding 10 years decline in applications to the medical school. So in January of 2003, we launched what we called the Relationship-Centered Care Initiative. And this was really an outrageous idea that we could change through appreciative inquiry and emergent design the culture of a very large medical school. And so we did use the idea of emergent design. Many culture change projects come in with a blueprint, and the idea is to follow that blueprint to get to the goal. We said we're brand new on campus. We don't know very many people. We will just look for energy and enthusiasm and build upon that energy and enthusiasm as it emerges. We started by empowering and paneling a discovery team of a dozen faculty who were interested in culture change. And they in turn did a set of rapid appreciative inquiry interviews, 80 of them. And the idea was to sort of take stock, get a snapshot of the organizational culture and context, and get it back to that organization. And we started with an unconditional positive question. And our question was, without being modest, and this was actually really a challenge for many people, please think of a time when you were at your very best at the Indiana University School of Medicine. What was it about you? What was it about those around you? And what was it about the organization that allowed you to be at your best? We got 80 narratives back. We did a rapid ethnographic analysis, and this is what we found. So here's a discovery interview with one of our faculty. I had a patient who had cancer. He lost both kidneys, was on dialysis, and had a stroke. An Indiana farmer, he had been extremely independent and was now very dependent. He was miserable. I had a third-year student, Chris, who got very close to the patient and his daughter. While I was out of town, the patient died. Chris took it hard. I called the daughter thinking she might be upset that I was out of town when her father died, but she was fine. A very religious woman, she told me that the family had wondered why God had allowed her dad to suffer so much, but now she knew why. She said he died to make Chris a better doctor. So here we had these 80 narratives, and these were the 4 themes that we found in the narratives. That when people were at their best, they believed in the capacity of everyone around them to grow and learn. When people were at their best, they felt connected to one another, and recall that anomie was one of the major challenges that we were facing. People were at their best, they felt passionate about what they were doing. And when they were at their best, it was just a wonder to have the privilege to care for others and be involved in this great profession we call medicine. So here are some things that we use. Here are the tools that Dr. Land mentioned. We always start meetings with an appreciative check-in. What went well today? Or as you are entering this meeting, what's one good thing that's happened to you recently? So it might be I did a great presentation on rounds, or somebody said thank you to me, or held the elevator door, or my son or daughter hit a home run, and I was there to see it. How many times have we missed those key moments in our kids' lives? Similarly, we use appreciative debriefs. We ask, what went well today, and how can we improve upon it? Sometimes we do an appreciative checkout where we ask people to say one word, an adjective that describes how you were feeling when you entered the room and how you're feeling now, as a way of taking the temperature of the group. Or, what's one positive thing you're taking from this meeting, and how will that help you remain resilient throughout the rest of the day or the week? And that's beneficial not only for the person who's saying it, but for everybody in the group. So as this process unfolded, we started hearing stories, and there was a cascade of engagement. People started relating to one another differently. There was student engagement. The admissions committee completely revamped its process of interviewing to interview from a positive perspective. And we became what we thought of as a narrative organization. We used positive stories all over the organization. This is kind of a busy slide, but it shows that in 18 months, we went from a group of 12 individuals who were collecting these appreciative stories to over 1,000 people in our organization, students, residents, fellows, faculty, administrators, all of whom were engaged directly in this change process. It was a pretty remarkable change. So I'm going to talk very briefly about a couple of student engagement activities. One is a booklet that we call Reflections. The other is Mindfulness in Medicine, which is an occasional column in our weekly electronic newsletter. So this is actually an old slide. We're in the 11th year of doing Reflections. This was actually a student idea. One of the students, when they heard about the appreciative interviews that we were doing, got together with another student and went out and they did 300 appreciative interviews over a summer. They came back, they distilled it down to about 20 appreciative stories, and we published it in a book called Taking Root and Becoming a Physician at the IU School of Medicine. And one of the two students said, wouldn't it be a good idea if we could put that booklet in the pocket of the white coat so that when the white coat ceremony took place, students would get a collection of stories of who we were at our best, rather than the dean saying, look to your left and look to your right. One of you won't be here in 4 years. And so this is a tradition that's carried on for 11 years now. The senior students collect stories, appreciative stories. They put them together in a new booklet each year. And at the white coat ceremony, the incoming students receive this gift from the upperclassmen. I'm just going to skip past this. So I want to tell you one very quick story. This is a photograph of Alex Andari and his sister. Alex graduated 2 years ago from the medical school. He's from Kenya and not from a wealthy family in Kenya. And he came to the United States to do his undergraduate training in Texas. And in order to fulfill tuition requirements, his aunt and uncle, who lived in Washington, D.C., co-signed for his loans. During the economic downturn, both his aunt and uncle lost their jobs. And out-of-state students now at IU School of Medicine, tuition is about $70,000. Without co-signers for his loan, Alex was going to have to return to Kenya because there's an immigration law that says if you're not matriculated, you have to return to your home country. The medical school's hands were tied. We didn't have any way of providing bridge funding for Alex. And a week before tuition was due, Alex mentioned to a friend of his that he wouldn't be back next semester because he wasn't able to afford tuition. It wasn't an ask, it was just simply information. This friend of Alex's got together with 2 other friends. They reached out to 300 of our first and second year students and said, if you will give $100 a semester for 2 semesters, we can keep Alex here, we can keep him in medical school. They found a grateful physician in the community who anonymously donated $10,000. And 1 week later, on the day that his tuition was due, they handed Alex a check for $75,000. And to me, this really speaks to the power of community, the power of the positive, to see the best in people. So now we're going to move to a polling question.
Yeah, thanks, Dr. Frankel. What an incredible story. Thank you so much for sharing that. So our first polling question should be appearing on your screens now, and it reads, so given the opportunity and given what you've just heard from Dr. Frankel, what percentage of your organizations do you think would engage in appreciative inquiry in order to change your organizational culture? So we're going to ask you to select one of the following. 0, do you think people just would not be interested? 25%, 50%, 75%, or 100%? So we're just going to keep this up for a couple minutes and see what kind of response we get. So, I mean, I think I'd sign up in a second, given what I've just heard happened at Indiana. But we'd love to hear from you how you think the idea of engaging in appreciative inquiry might be received at your own organization. And so that's great. We've got some great results in. And what we're seeing is that we have 29% of our participants say that a quarter of their organization might be interested. 44% are thinking this might work for about half of their organizations. 19% we're seeing 3/4, and 8% think that their organizations would go all in on exploring appreciative inquiry as a way to change organizational culture. So thank you for that. Dr. Frankel, do you have any sort of thoughts on these results before we jump back?
No, it looks like a normal distribution to me.
Yeah.
It's fascinating to know that nobody thinks that nobody would be interested. That's wonderful.
It is fantastic. Thank you, everyone, for participating.
So I'm just gonna, in the interest of time, just move to the results. And we use the AAMC exit questionnaire to look at our results. And you can see that on the question, overall, I am satisfied with the quality of my medical education, that we were well below the national average through 2003 when the Relationship-Centered Care Initiative launched. And then you can see, tracking along with that, there were very substantial gains in which we were well above the national average in terms of students' satisfaction with their medical education. Responsiveness of administration, we didn't see as great a gain as we did in terms of satisfaction with education, but we did definitely see some gains. But what we saw more than anything was in terms of applications to the medical school. In 5 years that the project ran, we saw a 100% increase in applications to our medical school. The average medical school, if you get 5 to 8% in a year, that's a really good gain. And we would ask students during their admissions interviews, why IU? And the answer we most often heard was that they had seen our competency curriculum, they'd heard about the relationship-centered care initiative and said, this is what we're looking for. And so using this AAMC exit questionnaire data, we saw some real changes in the culture. I'm just going to end with a quote from an article that our dean at the time, Craig Brader, wrote in Academic Medicine, in which he talked some about the relationship-centered care initiative. He said, from a personal perspective, the most consistently gratifying component of my responsibilities and day-to-day tasks has been our concerted efforts toward a culture change. Many of these stories that we've collected are in a file on my computer. I often open that file and read a few stories. Doing so always relaxes me, and in some cases, I'm overcome with emotion at what represents the very best in medicine. So I will turn it over at this point to Dr. Isaacson, and just to say that from ripples to waves, appreciative inquiry positively impacts culture.
Thanks very much, Dr. Frankel. Great, inspiring story. I'm going to talk a little bit about how we've applied appreciative inquiry at the Cleveland Clinic, which is a large academic medical center. We have 3,500 physicians, we have 1,200 residents, and we have a medical school here. We can move on. So our journey began in 2011, and I want to talk about this really at a level beyond training with students and residents. So we recognized in 2011 that we had defined professionalism competencies at both the medical school and the GME level. And these are requirements that we pay close attention to. But reflecting on this, it occurred to several of us that we had no formal programs in professionalism for our faculty. And so, moving on to the next slide, we discovered the need to explore professionalism at our academic medical center. So we formed a task force in 2011, and what I'm going to highlight for you through this story is really how appreciative inquiry played a role. So I want you to pay attention to that. So we had a 6-month exploration as a task force. We included various stakeholders important to this, including many from our education areas, the medical school, GME, but also quality and patient safety, physician health. We included nursing, our patient's voice through patient experience, ethics, and our administration. And what we did to start our journey, and I should let you know, Dr. Frankel was a collaborator, and we really built on some of the successes he had at IU. We used appreciative inquiry to start out our journey as a task force, and we really got to know each other as a community of task force members. And we started out sharing stories about when we were at our best in our professional roles. And what was fascinating was the fact that we had been together as a group. Most of us had been at Cleveland Clinic for many years, and yet the stories we told had never been heard. And so one of the real powerful, I think, conclusions about appreciative inquiry that I'd ask you to think about as you leave the webinar and go back to your home institutions is the fact that by using this technique, you unlock stories that are present in an organization, in a community, but often go unheard. So if we move on, I'll tell you next how we came to form our Professionalism Council. And we used appreciative inquiry in our council. So the task force gave its recommendations. It was endorsed by our chief of staff to continue on our work, and we continue on our work even today. And we started with something called Dialogues in Professionalism. And again, this is a technique that we adapted to try to say, what can we do for busy clinicians at a busy academic center? So we basically advertised a session on professionalism as an open forum, and we gave people a free lunch. And people came to the session not really understanding what was going to happen. Many of them thought they were going to have a lecture, a slideshow on professionalism. Instead, we used Appreciative Inquiry, and we asked participants who came to tell stories about when they were at their best in their roles as professionals at the Cleveland Clinic. And so we captured many of these stories on film, and we used these stories to create a community of our professional staff. We also found that this was a way to connect with people who were interested in this topic, and we had several members who came to these open forums, join our Professionalism Council, and get involved in specific activities. So it was really a wonderful way to connect people. As our council has continued to do its work, we have integrated Appreciative Inquiry into many forums. And it's really a wonderful tool. It's not the only thing we do, but it's a wonderful tool to get conversation going and to incorporate storytelling into the academic environment. So some of the examples, we use this with our medical students in their 5th year. We ask them to reflect on something in their 5 years of medical school that struck them as professionalism at its best that they will carry forward. I've been asked to do GME orientation. What do you do with residents who are there their first day, who are very nervous and excited? You can use Appreciative Inquiry to ask them to think about professional role models in their lives and to get them feeling very positive and a positive energy. We've also used this in department meetings, and I'll show you a video example a little bit later in the webinar of how you can do this very quickly to create positive energy in a group that works hard together through the year. We can move on to the next slide. Another thing we've done is we created an onboarding program for new faculty at Cleveland Clinic. So what we found was that many faculty at large academic centers join and they don't really experience a community, a culture of what it's like to be part of something greater than their individual small area in which they work. And so outlined on this slide are, we have several components that we've included. And we have, over a course of about 18 months, we ask people to participate in these seminars. They're all interactive seminars. And our first one that really highlights Appreciative Inquiry is our Introduction to Professionalism. And so we have participants from various places in our academic community. They don't come as a group from one department. They come from all walks and different geographic locations in our academic center and come together. They meet people for the first time. There's a sense of community developed, and we ask them to reflect on their professional roles and tell something personal about themselves of when they were at their best professionally. And these stories are often quite powerful, and they really bring a lot of emotion to the environment and make people feel connected. Other things we include, I've listed on the slide. We embed education, quality and safety, interprofessionalism, leadership, and physician support, all as elements of our onboarding. So new physicians and researchers feel connected in a way that they haven't felt before. And if we move on to the next slide. One of the most recent things we're quite excited about is we have an annual review process, the annual professional review in our organization. Many organizations have this, and it's often viewed in a negative light, that someone's going to be sort of judged at the end of the year as to how they're doing. And fortunately, our Professionalism Council has had some input with our Chief of Staff to try to reframe the dialogue around our annual professional review into much more of a reflective one and an appreciation and celebration of when we are at our best. So this has actually just come out in the last couple months, and I have listed here the actual question that all members of the professional staff have the opportunity to respond to during our annual professional review. And it says, we're interested in better understanding your unique contribution to achieving our organizational goals. Describe a time in the past year when you were at your best in advancing one of Cleveland Clinic's goals. And we've listed here some of the core goals that we focus on, and every organization has their own unique goals. But this has been something very interesting, and we're really just starting to collect some information about this, and we will be studying this to see what impact this has on our organization. But anecdotally, from filling this out and talking to other folks, it really, again, brings a positive energy. It's wonderful for staff to be able to reflect on something that profoundly impacted them and others during the year. We're going to move on, and I'm going to show you an example, and I want to just sort of prime you for this. So when I was asked a couple years ago to go to the hospital medicine department meeting to speak on professionalism, I had about 45 minutes, and I really thought about how can I make something impactful in that time. So again, people showed up in the middle of a busy day. There was lunch provided. You're going to see I did the video with a handheld camera, so it's definitely not professional quality. But what we did during that session was introduce the concept of appreciative inquiry, the concept of examining when hospital medicine as a department was at its best professionally. And we just asked people to pair up with a partner to share a story. And then I'm going to show you an example. We videotaped willing volunteers who wanted to share their story. And so you'll find, I think, in this video clip, responses to that question of when hospital medicine was at its best. So we'll go ahead with the video clip. Okay, so I think you can see from that brief video clip that there's a sense of community, a sense of caring for someone when they're not well, a sense of looking out for someone who's new to the department. And again, the important thing, I think, is that these are stories that had never been told before. No one heard them. And when I left that meeting, the chair of hospital medicine came up to me and was just so thrilled to have a 45-minute session that everyone left with such positive energy and feeling so good and proud to be a member of his department. So it really is an example of how just a brief intervention can really help boost morale and make everyone feel good about where they're working. So where we're at as of 2016, as a result of our professionalism initiative and with the use of appreciative inquiry, is really a centerpiece of how we create conversations around professionalism, is that we were able to create a professional staff resource center under our Chief of Staff's office. And we focus on professionalism, physician wellness, coaching and mentoring, and really have the ear of leadership. And so similar to what Dr. Frankel described, I think, at IU, we found at Cleveland Clinic, when you can use some of these techniques that focus on the relationship, that focus on when your organization is at its best, it creates space and conversation that can move things forward in a positive direction. And I think I'm going to turn it over to Stephanie again for the next polling question.
It's great. Thank you, Dr. Isaacson. Thanks for sharing that video. So on to our second polling question. It should be appearing on your screen now. And that reads, so of the appreciative practices listed, check those that you are most interested in applying to your professional role. Please select all that apply. So what we have here is the appreciative check-in at the start of meetings, the appreciative debrief at the end of meetings, sharing stories with others during meetings, being a cultural transformation agent, and increasing my own mindfulness and reflection. So if you wouldn't mind just checking the practices that appeal to you after all we've heard from Dr. Frankel and Dr. Isaacson about how they applied these within their own organizations. That's fantastic. Thank you. So, wow, I feel like everyone might be checking every single practice from what I'm seeing on the poll results here. We see 61%. No, sorry, no, 63, it keeps coming, percent interested in the appreciative check-in, 59% interested in the appreciative debrief at the end of meetings, 77% looking at sharing stories with others during meetings, another 77% interested in serving as a cultural transformation agent, and 71% looking at increasing mindfulness and reflection. Dr. Isaacson, do you want to weigh in at all on those results?
Oh, this is wonderful. I really think it reinforces, I think, the message we've tried to convey is that some of these things are relatively simple and easy to try. And I will tell you that personally, I have not been disappointed when I've tried this. We have even tried this storytelling in situations when we think it may be risky because there's leaders and you think they may not respond well to this, but every single time people have responded very well. So this is really exciting to see.
That's great. So at this point, we're going to turn the program back over to Dr. Lown.
Thank you, Stephanie, and thank you, Bud and Rich. That was fantastic. I am a really big fan of appreciative inquiry, and I have some questions, but I'm going to ask you some of the questions that came to us in our question panel here. One person wanted to know how to use this method without denying or hiding the challenging issues within an organization. So it's a question I often am asked as well.
Well, I'll take a crack at that. I think that's a very, very important question. And appreciative inquiry is not simply sitting around and singing Kumbaya, although I do know the words to Kumbaya. It's more framing the issue in such a way that when we do get to the challenges, we're not dispirited and we're not attacking one another, but we're looking for solutions that we as a community can take on together. So a lot of people, as you said, Beth, ask this question, you know, is it just feel good? And the answer is no, it's much more about the eyes with which or through which you see the world.
And I would add that, you know, there is a strong literature base for this method that's been applied in industry and medicine, and it's shown that you can get positive results with this method. When we have used this at Cleveland Clinic, we acknowledge the fact that this is not meant to solve all problems, but we also acknowledge the fact that for most medical centers and physicians in particular, we are very deficit-based thinkers, and that by nature helps us in our job. Patients come to us with problems when we seek to identify the problems and come up with solutions. This is sort of a liberating exercise to get people to step away from the deficit-based approach and to be asset-based, or to reflect on things that really are going well within their environment. And these are meaningful stories in almost all cases, and I think the fact that they're meaningful brings a positive energy and a sense of accomplishment and optimism to a group that may otherwise not have that.
Yes, I hear that, and I've experienced that. I completely agree with you. There's also this whole field of positive organizational behavior and positive organizational scholarship, and this theory, this Barbara Friedrichsen's broaden and build theory, about how positive emotions, especially the more frequently you experience them, widens your horizons. It enables you to see things more broadly, to be more creative, to be more innovative, and that has translated into consequential organizational and individual outcomes that they've described in their research. I don't know if you are aware of that, or if you have thought about that. I think it's really very, very interesting. So I think I think it helps prevent this sort of loss of purpose and meaning, the burnout issue. But I think it's beyond that. I think it extends us. You know, it's not just preventing it. It's opening vistas and extending our view. anyway, I think it's an interesting topic to take a look at. I wanted to ask you too, do you use the full, the Cooperrider described appreciative inquiry as beginning with this sort of discovery phase, the storytelling, it's let's discover the best of what is, and then he moves on to dreaming about the best that could be. So using the themes you've discovered in your first phase to dream about what's our image for who we want to be and could be, and then going on to designing it and to implementing it and that sort of stuff. Have you applied that full model, or do you find that just that first discovery piece is so powerful you can use that and see these kinds of changes, without even doing the rest?
I'll start. I think that you don't have to use the full model in order to get to, experience some of the effectiveness. And I think probably Dr. Frankel's large organizational change project used more of the components than we have. We've used some of these. I think what you've described is quite effective if you really have a group that's going to be working together longitudinally. So we use some aspect of that with our professionalism task force to try to figure out where we want it to go. But I think you don't have to have a rather large project in mind in order to start with some of this. And I would strongly encourage people, even the appreciative check-in, which is something I run several committees at our medical school, and I use that with every single committee. Had one this morning. Just starting by giving people a chance to acknowledge that they have a life outside of medicine in the committee, to hear something about their personal life that's exciting them, whether they have the birth of a child or a grandchild, or they've had some accomplishment in their professional or personal life. It brings a sense of community to that group that's working together, and it's quite easy to do.
Yeah, really, it's so appealing because it's so doable right away. Go ahead, Rich.
Well, I was just going to say that 12 years ago, we did the full process at the Regenstrief Institute, which is a part of the School of Medicine, as part of a strategic plan. And several of the groups that got started in the 4D process, which is what Cooperrider calls it, are still active today. So I think that each of the components can stand more or less alone, and it depends on the context and what change you're trying to bring about. We still use storytelling throughout the organization as a way of bringing attention to the positive. So I agree with Bud. It's not something you necessarily have to go through each and every time, but the elements and some of the very simple things like a check-in or an appreciative debrief are in and of themselves small changes in the culture.
Yeah, exactly. And I think what's important is the culture. You say the words culture change and immediately everybody's completely feeling overwhelmed and ready to, run away. But these are very concrete things that are not hard to implement and are, it start to yield amazing results as soon as you start doing them. So I think I appreciate that a lot. We have, I think, one more question, time for one more question. And one of our participants asked, have you or others used AI with patients to identify positive experiences with clinicians and then fed that back, the stories back to the clinicians? It's a great idea, actually.
It is a great idea. I have not. We have not done that at Cleveland Clinic, but that question has generated that as a possibility. I think it's a terrific idea. We all get measured now as physicians with different rating scales, numerical ratings, and we know that what's most important to the physicians is actually the comments. So sometimes we see some of that come through with measurements of how patients perceive us in the clinic or in the hospital. I think building in an appreciative inquiry type of question to that would be wonderful, and maybe that would be something aspirational.
So
Wonderful.
as part of becoming a narrative organization, we've collected stories that patients tell about third-year medical students on their pediatrics rotation, and we have fed back the information. You know, third-year medical students are pretty down on themselves, and being able to feed back this very positive information. You know, the parents are saying things like, you know, my attending physician spends 60 seconds with me, but the third-year medical student took an hour to really get to know my son or daughter, went downstairs, bought him a pair of slippers or a puzzle or whatever. And this person is going to make a wonderful doctor. And we've used it also from our third-year students to give feedback to residents, because, you know, we use appreciative storytelling. 70% of what our students tell us when they're writing these stories during the third-year medicine rotation are really positive stories, mostly about the residents and how positive their behavior is. You know, there's all of this focus on the hidden curriculum, but there are very positive things within the hidden curriculum as well.
Yes, and it's good to point those out. Well, I think we have to wrap up for right now, so I want to first thank you both so much for sharing your wisdom, your experiences with us on this webinar, and wonderful ideas, immediately applicable. It's really been helpful, and I have some new ideas as well, as you probably all do also. But I'm going to turn this over to Stephanie now to wrap up, and why don't you take it over, Steph, from here.
Thanks, Beth. And thank you, everyone, for joining us today for this hour. We hope you enjoyed this fifth and final for 2017 Compassion in Action webinar focused on organizational cultures of compassion. Thanks to our panelists today. And I will say also, we know how busy you are and how eager you are to either get back to work or home, but we would really appreciate you taking a moment to fill out our survey to evaluate this program before you go. So thank you all very much and have a great day.